Hi, my name is Katie Riley, and I'm running for House District 29, which is the urban part of Hillsborough, all of Cornelius, all of Forest Grove. So it's a fairly diverse area as well. I want to tell you a little bit about myself and then also talk about issues that are important to me to really work on when I'm down in Salem. So I was born and raised in Oregon, went to University of Oregon, got a bachelor's degree in English there, and then went to Washington State University and got a master's in sociology. And then it was very cold. It was like 22 degrees below zero. And so I applied for every job that was open in California that I was qualified for. I got hired at UCLA, and I ended up getting my doctorate there in education. And then I continued my career there as an administrator at UCLA for over 20 years and worked in many different departments. Probably one of the areas that you might be most interested in would be the fact that I was in the planning office there and responsible for multi-million-dollar budgets. One of the projects that I worked on was a $68 million project which involved moving many different departments around on the campus so that their spaces could be renovated. And my claim to fame there was that I had no fame because I was able to move everyone without any complaints, and my name did not appear in the campus newspaper once. So I was happy to have that happen. After UCLA, I was hired at Oregon Health and Science University here in Portland as the department administrator for the Department of Public Health and Preventive Medicine. And once again, I was responsible for budgets, but I also got involved in helping to develop and implement the Oregon Master of Public Health program, which involves not only OHSU, but also Portland State University and Oregon State University. So here I was working with many different personalities and people who were invested in their own particular areas, and we ended up being able to compromise, work together, and come up with a statewide master's program, which is very efficient. I was then asked to be the administrator or the director for our particular track in that program and to be on faculty. And as a faculty member, I taught classes. I taught women's health epidemiology and also adolescent risky behavior. And then I also did research on substance abuse treatment for both adolescents and adults throughout the U.S. and taking a look at how those treatment programs were operated and how to make them more efficient to help people out in the long run. During this time, I also got involved in volunteer activities. And I served as president of Oregon Public Health Association, was elected to that office, and also served as on the board of the Northwest Regional Education Service District, which, as you know, serves special needs children, as well as multiple administrative capacities for the different school districts. And then I also got involved with the Washington County Commission on Children and Families, and I'm still on that commission, have served for 10 years, and I chaired the group for 4 years. So you can tell I've held leadership positions, multiple different paid experiences, as well as volunteer experiences, which I think will be helpful in Salem in helping to make our state a better place. My top priorities are jobs, health, and education. Jobs, as we know, we have to get more jobs in the state so we have more income to do more things. And I would like to really promote small business growth as well, and I do have some particular ideas on that. Health issues, we want to improve access to care for people and reduce costs. And also I want to work on prevention of problems with kids, because adolescents tend to be the ones who start into problem behaviors such as tobacco, alcohol use, and we want to prevent those problems. And then finally, education, of course, we want to get more people, more teachers back in the classroom, stop cutting days and start to add days back in so that their educational system is improved and we have good citizens both in their work ethics and also being able to work productively, as well as being able to be good citizens in our communities. So I thank you very much, and I'm looking forward to your questions. Thank you.